All right. So good morning, afternoon, evening, everyone, and thank you for joining our live Q&A medical equipment and clinic electrification hosted by the Efficiency for Access Coalition and Power for All. My name is Joni Coker, and I'm a Senior Communications Associate at CLASP. And before we get started, I just want to go over a few things so you know how to participate in today's conversation. So first, if at any point during the webinar you're experiencing sound difficulties, please let us know by dropping a message in the chat, and a member of our team will try to assist you. We are going to start out with brief summaries of two recent publications. The first and the primary focus of today's event is the Efficiency for Access Coalition's report on medical equipment and clinic electrification. The second is from our partner, Healthcare Without Harm, who just launched their global roadmap on healthcare decarbonization, and their presentation will help provide a broad framing for the rest of the discussion. You're welcome to submit questions at any time during the webinar through the Q&A button on the control panel, and we'll try to get to as many questions as we can at the end of the presentation. So I'd now like to present our two presenters today, Siena Hacker and Sonia Roshnick. Siena Hacker is an associate on the Clean Energy Access team at CLASP. She coordinates with international partners and stakeholders to increase the integration of sustainable, efficient technology around the world. Siena holds a bachelor's degree in environment, economics, and politics from Scripps College. Sonia Roshnick is the International Climate Policy Director at Healthcare Without Harm, and she oversees their work to support health systems around the world. Sonia has 30 years of experience as a clinician working with health and social care internationally. She previously served as the director of the Sustainable Development Unit in the National Health Service in England. While there, she launched the Greener NHS program, including a commitment to net zero climate emissions, where she positioned NHS as the first national health system in the world to do so. She holds a master's degree in systems thinking and is a member of the Faculty of Public Health in the UK. So I'll now hand it over to Siena Hacker, one of the authors of the Medical Equipment and Clinic Electrification Report. So over to you, Siena.
Great, thank you so much. And thank you everyone for joining today. I'm really excited to present on our recent report. I think on the next slide, I just want to start with a bit of background. As some of you may know, many health facilities in the low and middle income countries have unreliable electricity access, if they have electricity at all. In recent years, having increasingly recognized the importance of the health energy nexus, some donors and other stakeholders have made clinic electrification a priority. They've started initiatives that focus on energy systems. However, many of these do not consider medical equipment. Focusing on medical equipment is a critical component of improving health outcomes, especially because most existing medical devices are not designed to perform in environments with limited energy supply or other challenging environmental factors that characterize these settings. Partially because of this mismatch in design, 70% of medical devices do not function in the global south and remain unused. We set out to better understand this issue. What's preventing primary health facilities from having and using high quality equipment? Why are companies that are interested in joining the space finding it so difficult? Through an extensive literature review and stakeholder interviews, we identified 7 major technical and commercial challenges, as well as some areas for opportunities that I'll get to at the end. So I want to start with the challenges. Thanks, Joni, for moving to the next slide. The first challenge, which I've already touched upon, is that most existing medical equipment is not designed for use in off or weak grid areas. Resistance to dust, heat, or humidity, which can be critical for proper performance, is generally uncommon. Most equipment is not compatible with DC electricity generated by distributed renewable energy systems. Efficiency, which is crucial for facilities with constrained energy supply, is often not a design consideration. Furthermore, most medical devices cannot handle power supply volatility, which is a major issue, as the WHO estimates that nearly 33% of equipment failures are due to power supply problems. Spurred by the COVID-19 pandemic, many companies we interviewed without a health background were interested in designing solutions for off and weak grid healthcare facilities, But they struggled because of the next challenge, the vast technological complexity and quantity of available medical devices. There are over 2 million medical devices across 22,000 categories. And many of these devices deliver the same health service through different processes and with different energy requirements, but it can be difficult to know which one is best. For example, the government of Bangladesh's registry of medical devices includes 8 categories of sterilizers, just one type of equipment, each of which uses a different physical or chemical process to sterilize a given object. Many companies have struggled and told us in the interview process that they didn't know which equipment to choose without better guidance. That leads us into the next slide. The challenge around available and accessible guidance, especially for those without a medical background. Official guidance on medical equipment that does exist is generalized, can be hard to find, and varies dramatically in terms of scale, focus, and specificity. The table on this slide shows how official guidance varies across 5 countries. Organizations operating in Rwanda, for example, would find over 100 recommended pieces of equipment for a primary healthcare facility, with 10 of those being electrical equipment. If the same organization looked at the guidance for Nigeria, they would find just 14 items and only one of those is electrical. Comparing between these two can be a challenge to understand which one to follow. Furthermore, our research did not identify a single example of guidance from national ministries of health focused on the selection of medical equipment explicitly for clinical electrification. Again, this is a major challenge for companies and organizations eager to engage in the space, but without a good starting place. On the next slide, we continue. While donor support is crucial to improving health outcomes, it can bring specific challenges. Donor-funded public health investments often focus on a specific health outcome or demographic. However, this small focus or tight focus can result in fragmented healthcare infrastructure that misses out on opportunities for holistic impact. These initiatives can also be constrained by the rules and regulations of an individual donor, for example, in terms of what type of equipment can be procured and from where. Another major challenge is equipment donations or dumping. In most low and middle income countries, donations make up an overwhelming majority of all available medical equipment, up to 80% in some countries. While many are well-intentioned, some come from large multinationals getting rid of excess inventory for a tax break. Donations are often dominated by substandard products that are older, lower quality, inefficient, and not appropriately designed for their setting. Donations at this scale can greatly reduce the interest among commercial players in developing products tailored to these markets, and eventually stunts the supply chain. As many of you on the call may not be surprised to know, sectoral silos are also a major challenge. Existing efforts to convene the health and energy access communities are nascent, and most focus on a wide array of issues. They often lack the funding or mandate to engage deeply with medical equipment. And like silos, existing regulatory frameworks are also nascent. Most medical equipment suppliers design products to meet FDA or European Commission regulation. These standards focus almost exclusively on safety and functioning, and often include nothing related to energy requirements, efficiency, or power supply. To begin to address these challenges, we've identified a set of recommendations that can be undertaken in the short term. We believe that the first step is a cross-sectoral convening space that elevates medical equipment. This can ultimately help stakeholders align on long-term goals. We also believe that health and energy access stakeholders should collaboratively develop guidance that provides explicit medical equipment recommendations for health facilities. This will take the guesswork out of solution design for clinical electrification efforts, which is especially important, as I noted, for companies that are new to the space without a background in medicine. Laboratory-based performance testing and field research will generate foundational data on energy requirements, durability, and service delivery. This can also be used to improve procurement decisions, identify opportunities for design improvements and efficiency gains, and also to establish a performance baseline. On the next slide, funding is needed to build markets, raise awareness, accelerate existing R&D efforts, and encourage new players, especially those in the local market, to engage with the medical equipment space. And finally, technical assistance should be provided to relevant government institutions, in addition to support for revamping the procurement processes in these countries. This can help catalyze long-term market building efforts and increase the commercial attractiveness of emerging markets for key private sector players. Some organizations have already begun to address these challenges and develop blueprints relevant to the recommendations I've just laid out. but greater support is needed to scale these initiatives and to transform health outcomes in some of the world's most under-resourced communities. If you're interested in learning more, I encourage you to read the full report, which includes deeper analysis and great quotes from our interviewees. So thank you, and over to you, Sonia.
Thank you very much. Thank you and congratulations on this wonderful report. I think it resonates how much we need to find the right adaptive solutions to different parts of the world. I guess what I'm going to talk you through is a global roadmap for healthcare decarbonisation, which really highlights that doing this well will also help contribute to reduce carbon emissions around the world. And if we move to the next slide, we're clearly amidst, I don't need to tell you this, amidst a climate crisis, which is also recognized as a health crisis because it's impacting so much on people around the world, be that through the sort of climate events, but also because actually pandemics are quite closely related to the way that we look after our environment. But it really does give us a bit of an opportunity because we could use the best of what we know about prevention, preparedness and equity to integrate it into the way we decarbonize. And that really is all about systems change. And I guess what you highlighted, Sienna, in your report is that this is about systems change. It's about how we set out what is required, how we integrate energy requirements, electrification, what kind of medical kit is needed, but also how we try and minimize waste through that process and build innovation. So, of course, if we go to the next slide, there are a lot of organizations that are already working pretty hard towards decarbonising. The NHS has set the net zero target with some very specific elements that are required to do that. And some of that is also about medical equipment innovation and changes that to make sure that we make the most of what is available. And that's it's maybe not so much around the sort of off-grid elements, but there are a lot of things that can be done in the Western world as well. In India, of course, there are already programs for solarization of clinics that are really, like in Chhattisgarh, where they're going on the process of making sure all clinics are solarized, and that helps with all sorts of different elements, including all the delivery of healthcare and decarbonisation and building resilience. So to go on to the roadmap, because we haven't got too much time today, it's really about recognising, if you click on for the next piece, what the health sector needs to do around this. Really, taking on the climate crisis is a bigger health threat than COVID, and we need to be able to do so whilst delivering health equity and climate justice. And that is going to be, like I said before, a real transformation. So if we move on to the next slide, I'll show you really how big the scale of this is. If you look at the blue wedge, it highlights what the business as usual is likely to be. And if we do not do anything to decarbonize, we will treble healthcare emissions. The blue wedge takes us down to what the governments have currently committed to, so it reduces that by a bit, but the emissions still go up. And what the roadmap does is really tries to cover this maroon wedge, which is really what we can do to decarbonize the health sector. And you will see that it still doesn't get us to zero emissions. There's still a sort of uncharted territory where we need to really push for innovation and new ways of doing things in the future. So one of the big findings from the report, and it won't be a surprise to this audience, is that 84% of the health care emissions come in some form from fossil fuel combustion. So a transition to clean, renewable, healthy energy is absolutely paramount to this, but also in the products that are derived from fossil fuels, so the plastics and all the equipment that we utilize. So if we move on to the next slide, we have outlined 3 different pathways, and you'll need to keep clicking through to help me move on with these. The first one is what you can do within health facilities and decarbonizing healthcare delivery. And that's, so the solarization of health clinics is part of that. The pathway 2 is very much about what you need to do in the supply chain. So making sure that the industry knows what to do about it and how they can make sure they're utilizing materials that will support the process, but also minimizing waste. And the third is really how this engenders a wider decarbonisation across society. So by making sure that the health sector moves in this way means actually that society will as well. So it's that advocacy. Move on to the next slide. I'm going to describe the 7 high impact actions that are part of this. I'm not going to describe all of them to you because there's, but we will go through them. The very first that we highlight is how we need to power healthcare with clean, renewable electricity. And of course, just like the report says, we need to make sure that the right kind of equipment supports that. It also means that buildings need to be orientated in the right way, located and positioned in order to deliver the best services. And that will be, some of that's about the grid, but some of it is also about transport and how to make sure that they're not in flooding zones. Of course, transport, food, which is the next one, and pharmaceutical products are also all part of what we need to decarbonize. And we've also put one in, which is really around the circular economy, or how we make sure that we reutilize products as best as possible and minimize waste. And I think that would fit into this whole conversation about the way medical equipment is used and how it's made fit for purpose for clinics that are off-grid or have got unstable grids. And the last one is about greater health system effectiveness, because there are so many countries in the world where we put a lot of money into the processes, but actually don't get the best health outcomes from that. So if we move on to the next slide, this is really all about transforming healthcare, and to get to the last bit of that, the last mile, we sometimes say with energy, this is the last mile of decarbonization. We would really need to make sure that our access to universal health coverage is as green as possible in every which way. So that will be around renewables, it will be around having the right kind of medical equipment reprocessing, minimizing waste, making sure that we're innovating and making that products are fit for purpose for the future. But it's also about making sure that we are able to integrate emergency response and pandemic preparedness in the way that we are doing things. So I'll leave the others there for now because we're short of time. But if you want to refer to the report, you'll see that there are a lot of recommendations on the next slide around what national governments can do to set the right policy agenda and guidance to support processes. And I think the report really highlights how that is so necessary to set the right kind of framework to be able to operate within. But UN and other international organizations can also do so. And I think donors, in the way financing is provided, to make sure that we do have the right kind of adaptive equipment that is fit for purpose for the future is really key. And I think that in some areas it will really be about innovation. So this last slide is to say thank you, and just to highlight this is very much every health professional's dream to get it right. So looking forward to the rest of the discussion. Thank you very much.
Thank you both, Sienna and Sonia. I'm going to now hand it over to Payal to begin our moderated discussion.
Yes, Sonia and Sienna, thank you very much for your presentations. I think you showed two very different sides of the issue, but both equally important and pertinent and of highest priority. So I look forward to the moderated discussion. And you've been already introduced to the audience, but I'd like to introduce the rest of the panelists. And if I could ask you panelists to turn on your cameras or your cameras, that would be great. And I'd first like to introduce Dr. Polita Zulu. I had the pleasure of meeting her last month, and she oversees the Zimba District Health Office in Zambia, and she is the district health director there. So we're going to get the chance to hear from someone who is working on the ground in these rural settings. Welcome, Belita. She has practiced as a medical doctor for 4 years at the University Teaching Hospital and Macha Mission Hospital. She received her medical degree from the University of Zambia. It's also my pleasure to introduce Gautam Narasimhan, who's Senior Advisor for Climate, Energy and Environment at UNICEF. Prior to joining UNICEF in 2018, he was working as an environmental engineer in the US and India, as well as supporting government and private sector clients on water treatment, air pollution control, and waste management. In addition, he's worked in the United Kingdom, where he coordinated a global portfolio of climate change themed products and services for an energy company, and more recently, as we're used to hearing from people from UN agencies, they've been all over the place. He's also supported the Afghan government in developing energy policies and identifying scalable renewable energy projects. He received a bachelor's degree in chemical engineering and public policy, as well as a master's degree in environment engineering and an MBA. I think you are very much a jack of all trades, Gautam, and we're very happy to have you here. And last, but certainly not least, I would like to introduce Anshul Gaur. He's the Director of Marketing and Global Partnerships at d.light Design in the Bay Area in the United States. So it's very early for him. Thank you for sharing your morning coffee with us. d.light Design is a leading solar manufacturer which is working to help the most vulnerable and financially excluded populations aspire for a brighter future powered by clean energy. He's got a background in consumer durables and electronics. He also has over a decade of marketing and product management experience across emerging markets in Asia and Africa. With that, I'd like to go ahead and jump into the questions. And Gautam, I'm going to start with you. You help lead UNICEF's climate and environment portfolio. Could you tell us more about what UNICEF is currently supporting with regards to deployment of renewable energy in clinical settings?
Thank you very much, Payal, and thank you everybody. And this has been such a great panel, and congratulations on the report. So UNICEF approaches this with having one of the larger on-the-ground presences in terms of supporting healthcare and healthcare systems overall. And we, in terms of electrification, our entrance into this started over a decade ago and came into it from the perspective of trying to keep vaccines cold chain integrity. And it became evident that not particularly initially for a climate or for an environmental perspective, but purely from a service delivery perspective, that distributed renewable energy was often the best way of ensuring that vaccines stayed cold. And so as part of that, working with Gavi, WHO, and other partners, I mean, there's a fairly large program that focuses on expanding solar direct drive fridges and reach to ensure the vaccines stay cold, and something that's becoming all the more important as a result of COVID. However, recently that scope has grown in a couple of areas. One, in terms of vaccines itself, it's looking at the cold chain across the entire value chain. So not just the end healthcare center, but also the district centers where vaccines have to be stored, the hospitals where and the energy needs for those are slightly different than end-use healthcare centers. So in that sense, our involvement has expanded both vertically and also horizontally, because as solar power and solar energy costs have decreased, service delivery has improved. We're starting to, in our program now is over 40 countries, of not just looking at the vaccine integrity for cold chain, but looking at the energy center more holistically, looking at the healthcare center more holistically. And what we're really trying to focus on is to see how we can help address some of this balkanization of energy systems that you start to see in healthcare centers, to where you end up seeing a set of panels for a solar direct drive fridge and a set of panels for lighting and a set of panels for something else. And there's very little of an emphasis on trying to have, one, a holistic understanding of what the healthcare center needs, and second of all, how this can be sustained in the longer term. One of the areas where we are trying to focus more on is trying to understand and represent demand for energy in healthcare centers, with how this energy and how this demand can be optimized using the kinds of appliances that other people have been speaking about here. And from there, we're trying to draw from our experience in vaccine cold chain. So when we kind of started off, we started to realize that by representing and aggregating demand over a whole set of countries, what that then does is provide the appropriate signals for appliance manufacturers, equipment manufacturers, to get an idea of the scale that is involved and be able to then invest in innovation. And then what we can then do, working with WHO and Gavi and others, is to progressively start tightening those standards. So you start driving the market overall towards a greater energy efficiency. And that's something that we've had decent success with in solar direct drive fridges. And it'd be wonderful as part of this discussion to see how UNICEF and other partners can help contribute towards that, towards healthcare electrification overall. Thanks very much.
Thank you very much, Gautam. And with that, I think it makes sense to go to Dr. Zulu. You've probably experienced some of this vulcanization and lack of holistic planning that Gautam spoke about. Could you share with us how the lack of access to electricity, as well as appropriately designed medical equipment, impacts the work of clinicians in off-grid areas of Zambia?
Good afternoon, good morning, everyone. Thank you for that question. I'm afraid you may not see me on video because I'm out in the field, so I'm having a bit of challenges there. Yeah, but for me on the ground, of course, our goal is really to see on how we can actualize universal health coverage, and primary health care remains the vehicle for getting to universal health coverage. Now, if the majority of the health facilities that we are using to actualize this goal do not have electricity, that then poses a challenge in the overall attainment of this goal. You are all aware that electricity really is an enabler in the delivery of healthcare services. I say this because we use electricity in all the settings. We talk about the general lighting, we talk about diagnostics, cold chain equipment. When it comes to treatment, and especially now with COVID-19, we know that oxygen delivery equipment is electricity driven. Yeah, and even when it comes to infection prevention, for us to sterilize the equipment that we are using in these facilities, of course, it becomes imperative that electricity is at the center of this. And so the lack of electricity then just poses a challenge from the quality of the service that is delivered. It also hampers on the responsiveness to the needs of the communities that we serve. And so just to speak a bit on that, we know that with the lack of electricity, it means that there's reduced contact times between the clients that are being served by the clinicians as well as the health system, because then the facilities cannot operate 24/7. They're only open until maybe 4 o'clock or 5 o'clock in the afternoon. And so that becomes difficult to provide these services. There is also the inability to attend to emergencies, especially in the night. And so when there is that delay to attend to an emergency, of course, on the part of the client, there is unnecessary suffering. And then in terms of the disease prognosis, of course, then that will lead to complications, which will then result in consumption of more medical logistics to attend to those challenges, which the clinicians in these rural facilities already have challenges with. I think for them, managing complicated cases is really a big challenge. Yes, so when we speak of limited diagnostic capacity, of course, we know that in the rural health centers, the typical equipment that we tend to see include the equipment that we use for measuring hemoglobin. There's microscopy. Of course, there's diagnostic equipment for TB and the same cold chain equipment. And so if these are not available at the primary health center facilities, then it means that clients have to access these at the higher centers. And so then that adds to the cost of healthcare service delivery to these populations. And we know that I think in the attainment of universal health coverage, we are speaking of a fair financial contribution. So to move these clients from these villages, these rural settings where they can't access diagnostic equipment to the advanced centers in the urban areas, that poses a challenge. And for many, it actually equates to a lack of access to essential healthcare services. It also means that then the overall health system is not responsive to the needs of these communities. The other thing that we have learned also about electricity, especially in the times of COVID, there is a lot of shift towards telemedicine. And so that may not necessarily be the traditional medical equipment we have been talking about, but it means that we are depending more on the electronic health records and of course this virtual presence, even with our consultations with the clinicians on the ground. Now, if electricity is not there, because all these gadgets are electricity driven, then it means that it becomes very difficult for us who are better placed in the more urban settings to support the clinicians on the ground with the necessary care that they need to give to our clients. And so, all in all, I think the absence of electricity on the part of the clinicians means that then the health outcomes are compromised. So it becomes very difficult to improve issues like maternal mortality, the under 5 mortality in the absence of electricity. And finally, to speak on the challenges with the equipment, of course, as the other speakers have highlighted, I think the issues of the design, first of all, we get this equipment and we don't know how to operate it. And there's no one nearby who can give you that support on how to operate the machine. It even gets worse when the machinery needs servicing and repairs, because then we have to depend on consultants who may be as far as Lusaka, the capital city. And so the equipment downtime is very long for most of our medical equipment. The months that they are actually operational is very little compared to the desired time when they should be functional. And so that compromises even on the quality of the services that are being offered to the community. And sometimes because they are also not compatible with the minimum power that is there in the facilities. Most of the rural health facilities only have enough power to maintain the cold chain functions. So when we get this additional equipment, of course, there is that excitement on the ground. You have extra equipment and you want to connect it to this system, which is not adequate. That leads to short circuits and again, damage to the equipment. And so really, I think the desired should be a situation where the power is there in the facility to even support the medical equipment as it comes. But what we have now is more of a push kind of arrangement. You get the equipment before the power is installed in the facilities, and then you kind of have to work backwards. And so that hampers on the benefits of the overall equipment. Thank you. That would be my response.
Thank you, Dr. Zulu. I think you very clearly laid out what happens when you don't have electricity as an enabler, and what happens similar to what Gautam talked about when there's not coordination and an understanding from the demand side and the supply side of what's needed. With that, I want to move to Anshul. And okay, do you have your camera on? If you could tell us more about d.light's work on clinic electrification to date, and also share anything about your experience finding appropriate equipment and medical devices, as what Gautam and Dr. Zulu and Sienna said. Have you seen that with regards to what they addressed today?
Yeah, thank you for having me here. I'm really glad that Dr. Zulu spoke before me, because she hit the nail on the head. Those are the exact challenges that d.light has set out to address. As of today, we've managed to electrify about 500 clinics, mostly based in Kenya. All of this came about as a result of some basic conversations that we started having last year, somewhere around the same time. At the onset of the pandemic, when we started seeing significant declines in payments by customers, As you might be aware, almost all of our customers form the base of the socioeconomic pyramid and earn less than $5 a day. So for them, even a mild fever, for example, is a huge financial strain, and it immediately impacts other aspects of their life, especially nutrition, access to energy, charging mobiles, etc., certain basic necessities. When we did our research, we found that most of these issues were related to health expenses that were coming about. So we went a bit deeper, and we found that almost all of these customers were relying on the private health sector, which was more disorganized rather than public, just because the communities are based in remote rural locations, and for them traveling 15 kilometers one way is a challenge, not to mention expensive. In a lot of cases, even during the time that we set out to do our work, we found that the government facilities used to have strikes. So there used to be a sudden splurge of pressure on the private healthcare facilities to provide, especially considering that most of these people would not have the money to pay for those services. So health outcomes were suffering. And we spoke to some of our investors, and we put together some funds to start electrification of facilities located in these communities. We faced both demand side as well as supply side challenges, as you might imagine. On the supply side, getting funding, as it was mentioned, no player in our industry is currently equipped to jump right into healthcare sector, just because of the lack of guidance and information available to us on what the prioritization should be in terms of beyond just electrification. Of course, that's one of our core businesses, to provide the energy hardware, but the utilization of that energy, the equipment that should go along with it, there's very little guidance on that. Most of the suppliers that we were speaking with, vendors that we were speaking with, did not deal with smaller solar home systems, anything below 5 kilowatt hours. It was a challenge for them to provide a tailor-made solution that could fit our needs, despite showing them the potential for expansion as a new revenue model for them. If they were to do some innovation, it was just not right-sized to our systems or our needs. I think that's where CLASP and their Global Leap Awards really helped, because during our research, we found that refrigeration was the #1 need, especially for vaccine storage and other medical supply storage. So we did reach out to finalists from the past results, and we were able to source refrigerators for basic medical supply storage. Besides that, we also found that for most of these clinics, they're not digitally connected. So Digitizing Health was another initiative that we took. As Dr. Zulu mentioned, electronic medical records and contact tracing during times of COVID, these were two important needs of these clinics. So we bundled together our solar home system, the X3000, the largest one that we have in our catalog. We bundled that with Sundancer's refrigerator, the medical refrigerator, and our d.light smartphone together. And we were able to not only electrify 500 clinics thanks to funding from FMO and Sweat Fund, but we were also able to provide them at least some basic health equipment to get them started. On the demand side, the biggest challenge that we found was just figuring out a list of qualifying clinics that we could then go ahead and start working with, because there's no single list that is available anywhere. And we just had to go through clinic networks and figure out which clinics were the ones that needed the most help urgently. So combining these two efforts, we were finally able to get started, but it's a long road ahead. It's an estimated 50,000 primary healthcare facilities across across Africa, and we've just managed to hit like 500 of them. So yeah, that's where we stand.
Thank you very much, Anshul. I think nevertheless, it's a start with the 500 and having a greater understanding of what some of the barriers are, hopefully will allow for solutions to emerge that will result in allowing for scalability. Because we know that, as you said, there's thousands, tens of thousands of clinics that are still not electrified. And I'm going to move on to Sonia. And Sonia, I think what you're doing is very important, bringing together the issue of health and universal access with even bigger crisis that the world is facing beyond COVID, unfortunately, the climate crisis. And you started to touch on this in your presentation, but we didn't give you a lot of time. So I'm hoping that you could go a bit deeper and share a bit more about the biggest opportunities that you see with regards to clinic electrification efforts in order to demonstrate best practices for the health sector more broadly in terms of decarbonization. And I really believe, as you said, that it can be a game changer.
Thank you so much. It's true that I took you through at a very high level through the roadmap, and it might be useful to illustrate where the biggest opportunities are with one or two examples. So, I mean, really the biggest thing is that we can deliver greater access to healthcare around the world by greening a number of elements. And one of those is making sure that we've got clean, renewable energy available 24 hours a day for clinics and healthcare facilities. And I know from Chhattisgarh, certainly it demonstrated that that really improved the access for patients. I think 50% more patients were able to access facilities at different times of day, and obviously the consequential better health outcomes that come from that. So that's really absolutely key. I think the other point that's been touched on as well is making sure that we utilize energy efficient equipment, and certainly one good example from the Mayo Clinic in a completely different part of the world is that by changing all their the cold storage facilities, they were able to save 60% of energy by going for low energy ones, and also save a lot of money as a result of that. So of course we need to sort of electrify or move to renewable energy, but we also need to be as energy efficient as possible, so that we have got space for the energy to be used by, for instance, the telecommunication mechanisms that were mentioned earlier. And that's the other example I'd like to highlight, is that actually if we can adopt more telehealth practices and focus on health promoting activities and prevention and preparedness, we will set ourselves in a better place for decarbonizing healthcare and actually providing better resilience for not just individuals as patients, but also for communities. And I guess that's my last point I'd like to make, is that the greatest opportunity is for health facilities to act as anchors for their communities, to really around providing access to energy, but also access to good basic healthcare. We don't need to have modern Western techniques everywhere, and we can focus on preparedness, prevention, and resilience. So my great belief is that you can integrate all of those into one. That's what system transformation is about. And that's the journey that this report highlights, and that all the other speakers before have highlighted as well. So thank you very much for all your work, everyone.
Thank you. Thank you very much, Sonia. And I think that really is the sign of the times, or the pulse that we really need to see where there are connections and how we can battle a number of fronts at once, and to use a violent expression, to kill one bird with many stones. And with that, the great thing about these kind of webinars are that not only do I get to ask everyone questions, but so do you. And so I want to encourage all of you to add questions to the Q&A. We will leave a few minutes at the end so that the panelists can respond to them. And I'm sure there are many questions, ideas, comments that all of you have that I will not be able to cover. And with that, I'd like to go to our last panelist, Sienna. Thank you very much for co-writing the report and presenting it earlier today. And I was hoping that you can share with us what the most surprising thing that you learned while doing research for that report was.
Thanks, Payal. And I'll keep this short so we have enough time for audience Q&A. But I think, when we began this research, we started with the hypothesis that there was room for efficiency improvements, and that was what we were most interested in. And we really didn't, know the scale of what we'd be finding, that there were so many other areas for opportunity. And I think having read it so many times now, the WHO stat that 70% of medical equipment in the global south does not function and remains unused. That to me continues to be a bit of a jaw-dropping stat. So I think just the scale of the issue, but also getting to see the great initiatives and how many people are working on this, how many organizations, and all of the great panelist work that we've had on this too.
Great, thank you very much. And I'm just gonna ask Jeff and Joni, do we have time for another question, or shall we go to the audience? I think a couple of questions have come in.
Why don't we, if you want to ask maybe one more question while the audience, if anyone else that's on the line has other questions, we've got a few in, but please drop your questions in the chat and we'll be able to pick them up maybe in a minute or two. But Payal, why don't you take it for another couple minutes? Okay,
great. Thank you very much, Jeff. So I'm gonna let whoever wants to take this question jump in from the panelists. And we heard at the very beginning 2 excellent presentations with regards to decarbonization, as well as to design and feasibility of medical appliances. So based on your experience, as well as your organization's work, it would be great to hear from a couple of you what part of the opening presentations really resonated with you, either in terms of a barrier that you see or an opportunity that you're suddenly excited about. So I welcome any of the panelists to jump in with the response to that question. Anshul, did you want to jump in?
Yeah, first of all, extremely insightful presentation, especially coming in from the private sector. It's eye-opening for us to see that the problem is not just localized as we were fearing, but requires immediate attention. As Sienna also mentioned, in some places we are suffering from lack of funds to actually make any progress, and then there are other places where you have 70% of medical devices that are just sitting there idle or defunct. And then 1 in 4 facilities lack electricity altogether. Another point that Dr. Zulu made was that in a lot of cases, especially in Zambia, because I've had experience there, the medical equipment reaches before electricity does. So it's just sitting there and nobody is really training them how to use the product. For me, going through these reports, I think besides, of course, managing funds more effectively, managing public-private, handshakes essentially for these initiatives is also important. As is mentioned in the report, that health and energy are 2 separate silos that are not talking to each other right now, and because of that, the lack of guidance, the lack of prioritization, the lack of even having knowledge of which clinics to address with what, kind of equipment. Because we are from the private industry, we have the capability of actually taking these requirements and taking it to vendors and getting stuff done, essentially getting the equipment manufactured right size to the needs of the clinics. But the lack of that knowledge is really preventing that from happening today.
Thank you, Anshul. Did anyone else from the panel want to jump in with a response to that question? I don't see anyone. In that case, I'm going to pass it to my co-moderator, Jeff.
Great, thank you so much, Payal, and thanks to everyone for such a great discussion already. I've learned a lot based on your all's responses to the questions and also the introductory presentation. So we've got a couple questions that have come in from the audience, and anyone else, if you have questions, please feel free to put them in the chat. We've only got a couple now, so we should be able to get through them. But even if more come in and we're not able to answer them, in the 8 minutes we have left, we can certainly try to respond in the chat or just follow up with you directly if you have questions. So I think the first one that I'd go to, and it maybe it's kind of a nice follow on from what Sienna said in her answer about the sort of shocking statistic about the percentage of equipment that has been both sort of donated or dumped, as well as the equipment that's unused, broken and going unused throughout the global South. And the question is, we need innovative solutions to manage the current accumulated medical equipment in developing countries, which I understand is referring to the sort of aggregate amount of unused or broken medical equipment that already exists throughout the global South. And that's something that we certainly, saw, photographic evidence of during the research that we did that went into our report on medical equipment. So what would be the starting point, especially that these countries, especially in countries where there is not, maybe pre-existing appropriate waste management policies and technologies? So to summarize, the question is, as we think about sort of improving the design and performance of medical equipment to be appropriate in these areas moving forward, we also probably need to start thinking, more holistically about how to deal with the already substantial amount of medical equipment waste that has resulted from products being unused or unusable. So I don't want to put you on the spot, but Sonia, I know that Healthcare Without Harm has done a lot of work on waste management generally. So I'd love to see if you have any thoughts on this, and then maybe either Dr. Zulu or Anshul from a practitioner's perspective. I'd be curious to know what you see as the potential options for dealing with equipment that doesn't work, is already broken, or that when you get it, it doesn't work. But we'll go to Sonia first.
Thank you very much. I mean, you've highlighted it's such a big issue here, and it is sad really that not only do we have to find good ways of managing the waste going forward with the right kind of kit that's fit for purpose, and that could be maybe reused in different ways, but that we've also got to deal with a legacy of all this equipment that's already out there and not being used. And I think clearly having good sustainable procurement policies in situ is really key. Some of that's about being able to segregate it well and then manage the different elements properly. And I think that would be not just within the healthcare sector, but within the countries itself. And we've done a lot of work around that. There's a lot of materials on our website that would be able to support you with it. But then there's also so there's a segregation, there's dealing with the old kit that we need to would be at country level, and I think the other bit is making sure that the sustainable procurement is right so that it supports those processes. So you can't tackle one without tackling the other at the same time, because they're so closely interrelated. And I think I don't know, I mean, the thing that comes to my mind is that we need these cleanup operations, because in a way, it's part of our dumping that has created this problem. And there's something about how we clean that up and make sure that kit is fit for purpose. Yeah, I think in every country, there will need to be sustainable waste policies and sustainable procurement policies that are interrelated. And that is not just about the health sector, it's about wider country policies as well. So there's a lot of work to be done there.
Great, thanks so much, Sonia. I'm just actually looking at the in the interest of time. Why don't we move to the next question, because I think it's probably of interest to the folks on the line, and that is about basically how in a clinical, in clinical settings, how can either donors, donor organizations, or organizations that are on the ground, delivering health service, how can you plan for and support the development of local capacity that's focused around managing or providing maintenance for energy systems that are in clinical settings? And so, maintenance and after sales service is obviously a major issue in the off-grid solar sector generally. But when you, when you're looking at the sort of specialized systems and equipment and devices that are used in clinical settings, I expect that challenge will, be even more complicated. So maybe we can go to Gautam first from UNICEF. I would love to maybe hear a little bit more about how UNICEF approaches maintenance of the systems that have been deployed, given your expansive field presence.
So thanks very much, Jeff. And it's certainly not an easy, if this was a problem that had been solved, I don't think we'd be seeing the mess that we're in. But so I'll perhaps answer it from more of a narrow perspective of areas where at least some of these issues have been addressed, by no means all. And this is particularly around solar direct drive fridges for vaccine integrity, which is of course a much narrower part of the overall picture. But in that, what we along with partners try and do is look at it from a few different levels. So there's one at the equipment level, and so there, by being able to aggregate demand to the extent to which you can have global suppliers and global manufacturers and a certain degree of quality, you set quality standards. And so that's quality standards for equipment that has a certain lifetime cost, warranties, etc. And then during installation, there's also a qualification mechanism for people who install the equipment, so it's installed properly. But perhaps most importantly, it's the process of saying, once it's installed, how do we build in as part of the contract an initial period of O&M, but we only do so with a partnership of the host government, saying that after that period of O&M, there has to be enough on-budget financing and training to ensure that there's equipment, that there's maintenance ongoing after that. And that is part of a monitoring mechanism that then gets rolled up to a global level and then influences how we do further vaccine rollout and everything else. It's a very narrow, I mean, of course, this is a much narrower part of the puzzle, but would love to hear also from other panelists to whether these lessons of one, being able to aggregate demand on a global level so you have the right incentives for people to produce. Second, you have standards for equipment. Third, standards for being able for installation. And fourth, there has to be a sustainability plan of saying, no, you can't throw it off over the fence right away. But neither can it be the responsibility, neither should it be the responsibility of, if this is a donor organization, of maintaining this throughout this lifetime, because that's not going to work. So looking at it at a few different levels.
Yeah, thanks so much, Gautam. And that, O&M is a big topic of this discussion in the clinical electrification space broadly, even focused just on the energy systems themselves, right? And when we start thinking about the potential of deploying more holistic kits along with the energy system, beyond refrigeration and lighting, perhaps, I would think that it would make it even more imperative to incorporate that kind of O&M planning, because when you've got a wider variety of equipment and devices that are being deployed, that obviously raises a whole host of new risks in terms of equipment performance. So I think that sort of forward planning for O&M and approaching that as holistically as possible, right? Maybe building even further beyond the current discussion of it, I think really resonates with us in terms of what we saw in our research as well. I know we're at time, I believe. I was hoping to maybe get Dr. Zulu's perspective on this last question. If we want to go maybe 1 or 2 more minutes, Dr. Zulu, and then we'll wrap things up. Dr. Zulu, just on this maintenance piece, right? Because you've obviously dealt with a lot of issues with malfunctioning equipment or just lack of availability of equipment. Maybe if we could close things out and get your thoughts on the potential to develop local capacity for the kind of maintenance, ongoing maintenance and operations support that we've talked about, especially related to medical equipment. Do you see an opportunity there, or do you see challenges in trying to do that?
Thank you for this opportunity. Of course, I see both. There's a lot of opportunity in there. We really need to build capacity in us, the operators, first of all, in knowing how to operate this machinery, and also the supportive infrastructure, because sometimes even the placement of the machinery is not well thought out. And so maybe you place machinery that needs to be kept at a certain temperature in the absence of, say, air conditioning. Of course, that tends to shorten the lifespan of that equipment. And also the maintenance plan. Yes, in most cases, I think that is where the problem is. The maintenance plan is not there. So you get this equipment and on the ground, you have not done any work to actually plan on how to maintain it. So it just comes there. You don't know whom to call when there's a problem. And so really, if we invest in this maintenance plan, and of course, we deliberately deploy people, local people that can manage this equipment when there is a problem, I think will go a long way, because more often than not, I think we are depending on outside support to maintain this equipment. And then that tends to be more expensive on our part, because I think the situation that we find ourselves with is when we recognize that there is a problem with the equipment, then we have to look for outside support, and we are expected to cover the cost. And that is too expensive for us. So sometimes we opt not to. Yes, but if we had our own local people to do that, and they're already deployed as part of the workforce in the health system, then that becomes easier for us. That's my submission. Thank you.
Great, thank you so much, Dr. Zulu. That again, it really resonates with a lot of what we saw in the research, and I think what we all would like to see as we hopefully start to solve this challenge at the scale required. That community members, individuals, living in these communities and other organizations that are directly impacted by it can also benefit from and play a part in sort of the work that's happening to solve it. So we appreciate that, Dr. Zulu, and I think that's a nice note to close things out on. I know we're a couple minutes over time, so I just want to thank everyone for joining. I think it's been a great discussion. The topic of medical equipment, is obviously important to us in the context of clinical electrification, and we look forward to continuing this discussion both with our participants as well as all the folks that were on the line. I just want to thank, in particular, our guest panelists for sharing their knowledge and their insights on such an important and we feel under-discussed topic, the role that medical equipment plays in often weak-grid clinical electrification, and let everyone know that we'll be circulating a recording of the event within the next few days. And if you did have questions that you weren't able to get in the chat or that have just come up, feel free to reach out to us directly. We're happy to follow up. So thank you very much for joining, and have a great rest of your day.